Welcome to Startup Greece Talks. On this episode, I will meet Maria Pallidou, co-founder and CTO of PhosPrint. Welcome, Maria.
Hi, Thanos. It's good to be here. Just a correction, I'm CEO, not CTO. CFO.
CFO of PhosPrint. Exactly. So thanks a lot for being here. It's a pleasure to meet you and learn more about PhosPrint and what you are doing on that field. That it's quite promising, and as we've seen, there's been quite big progress on that field the recent years. So welcome, and very nice to have you on that meeting.
Good to be here, Thanos. Thank you.
Where are you
for inviting us. Right now, I'm in an office at Deree, the American College of Greece, because I teach some classes in the afternoon, and that's where I am. So our offices, PhosPrint offices, are in Lefkipos at the Democritos Technology Park. So, but since we're having this talk in the afternoon, you caught me in my after office occupation, which is teaching.
So you combine teaching with as as entrepreneur and running a spin-off company or startup or whatever. So how is it? And please share with us some more about your background and some more things that could make us understand who is Maria and how you come up with PhosPrint.
Okay. My background is in corporate finance. I spent more than 20 years in corporate finance roles, regional finance in the last 10 before I left the corporate world. So Johnson & Johnson was my employer. I was in medical devices, or MedTech as they call it now. And I had a regional finance director position in the EMEA region, Europe, Middle East and Africa. I pride myself in being a business partner finance person. So I believe that finance should go hand in hand with the business in order to be more effective and more impactful. Then at some point, I decided that it was time to do something else. I left the corporate world and I joined PhosPrint's team 5 years ago because I happen to know Dr. Ioanna Zeriotti, who's the CEO and co-founder of PhosPrint. And since I wanted to get more involved into at the time, the growing Greek startup ecosystem, I joined PhosPrint very, very happily. We also have another co-founder, Dr. Apostolos Klinakis, who's the clinical director of PhosPrint. So those are the three co-founders, and we're very happy to be part of that team. So in the afternoons, I teach entrepreneurial management courses. So it's all very, very related to what I do in my day life. I teach entrepreneurial finance and 2 other entrepreneurial courses in the afternoons.
So have you ever, you have a background from the corporate business and the same time from as an academic instructor. Have you ever thought about being an entrepreneur and running something that you have created, or how is this experience?
I like the challenge. To be honest, during my corporate life, I wasn't thinking about that so much. I had to be, because if you have those senior positions, take all of your energy. So, and I'm the kind of all or nothing type of person. So I was very, very concentrated. But when I left the corporate world to do other things, that was something I had in the back of my mind, and it materialized with my participation in PhosPrint. So I got what I wanted so far. I'm very, very happy, very grateful for all the experiences. Yeah.
That's great. And I think, the reactions and the feeling being in a classroom, talking with people that are interested on the field of startups, entrepreneurship, it's something that it makes you happy, and you get more insights, and you understand the world of entrepreneurship from another aspect.
Well, Thanos, I think there is also a generational duty, I would say, towards the students, the ones that are coming out of university now, because my generation had a lot more good paying jobs than this generation, because there were a lot of multinationals at the time. Even in small countries like Greece, they had a bigger footprint. It's coming back again, of course, with the data centers and all of that, but also the startup ecosystem is creating very good jobs, development-wise, pay-wise. So it's important to get more and more students interested in a startup career.
At least to trigger, to trigger their interest on
exactly. Yes, exactly.
The main, I think the main point. So great.
Exactly.
And let's go to PhosPrint, and please share with us what is PhosPrint and what are you doing there.
Yeah. So PhosPrint is a laser bioprinter developer. It's what many people who are not scientists like myself used to call or still call rocket science. So basically, we have a fully functioning industrial level bioprinter that prints cells. And we have tested the bioprinter on animals, preliminary, on pigs, smaller animals like rodents and pigs, and it works well. And we have a first application, which is in bladder augmentation. So we plan for the first time to print a new bladder to replace parts of the bladder that have cancer in vivo, which means the operation will be completed, the printing in the operating room.
I think that it's quite promising. So please share with us, what is the exact problem that you are trying to solve with that?
We are trying to solve with this first application. So as you can appreciate, bioprinting is one of those medical applications of the future, medical innovations of the future. But so currently we're starting with one application, which is bladder cancer. The problem with patients that have bladder cancer is that after they have cystectomy, which is removing that part of the bladder that has cancer, the current best practice is to create a new bladder from intestinal tissue. Mm-hmm. The problem is that some of that tissue has side effects. It creates mucus. So what we will do, through the printing, we will actually augment the bladder with that part of the tissue that is more compatible with the rest of the organ, so that there are no side effects. Okay. We have also estimated that the side effects will may take up to 3 years to be addressed, and the cost only in the first year alone of the side effects of having repeat surgeries and post-op complications, fixing post-op complications can be up to 20,000 euros. Oh. So we are trying to address quality of life and cost aspects for the healthcare system with this first application.
Okay, and this is something that how you come up with that idea? I mean, it's a research project that transformed to something on the entrepreneurship world.
Okay. Well, first of all, we had an operating prototype of the printer, and we were trying to find the best or the most suitable application to prove the concept, okay, of in vivo bioprinting. 2 reasons why bladder cancer. Number 1 reason, our clinical director, Dr. Apostolos Klinakis, has an expertise and a lot of research in the particular area, which is bladder cancer. Number 2 reason, since we are in Greece, and I don't know if you know, Greece has the number 1 prevalence of bladder cancer in the Western world. Oh. It's only second globally to Egypt. Oh. That has to do with life habits, especially in men, which is mostly smoking. Okay, so this means that you have the key opinion leaders, the physicians are experts. Okay, this is a case that they are used to treating, and so you will have a very good base to start with. given that we are based in Greece, and we will start some of the trials in Greece.
Okay, so it seems like you have the, you have the ideal, let's say, customer, or you have the, you have a really important case to face, and it's quite important for our lives and all of that.
Yes.
How's it going so far? What's the progress that you have the recent years?
Okay, in the recent years, given that this is a medical project, okay, this is MedTech, this is a biotech, it's more of it's a project that has a longer time to be finalized, okay, it takes a longer period. So we need to run preclinical tests on animals and then start with 3 phases of clinical tests on humans. We realized that we had to attract also patient funding to fund at least the first steps in our development. So we were very successful. We are very proud to say that we are the first Greek startup to receive the European Innovation Council's Accelerator Grant First. This was awarded to us with the October round. I think we're still the only Greek startup that received it. So hopefully more will follow. And we are currently seeking additional funding of 800,000 to help us complete the first very, very important steps in our proof of concept, which is in about 2.5 years complete phase 1 clinical trials on humans. Okay, so we have a very, very detailed plan prepared, which was approved by the European Innovation Council, of course, that with very, very specific tasks that would take us to the proof of our concept, at least in the first phase, with the completion of phase 1 human trials. By the end of, we expect end of 2025, beginning of 2026.
Sure, it takes long in order to be on the market. It takes long to get all these needed in order to apply them to the human body. Sure, yes. And it takes long for sure. What about the technology that you have built? It's
we have
more about that.
It's protected with a PCT. Of course, we have a dual laser beam bioprinter that is functioning well. And actually, we have 2 versions of our bioprinter. We have like a desktop model of the bioprinter that will be, it's catered to researchers. Okay, so imagine the first, like a Canon printer on your desk. So that's a desktop type of bioprinter for researchers. And then, of course, we have the in vivo bioprinter model, the one that will be used in the operating rooms for the application of applications. So that is the technology we have, which is protected with PCT, so the patents are pending. But we have developed both hardware and the protocols on how to apply the technology and the method of creating a new bladder.
Okay, it's a good pass to say about the printers and what you have developed. Because my next question is how you believe you're gonna make money. Are you going to produce more instruments like that, or you're going to? What's the model that you are going to use in order to let's say scale it up?
Okay, so first of all, our targeted year for full commercialization is 2027. Okay, for full commercialization of all of our revenue streams and for the application to be commercialized. So until then, we will have the first revenue stream we will have is selling our desktop printer, the lab for the researchers, to lab researchers, this will start as pilot sales, because we want researchers to use our printers and share their findings with us, okay? And then as of 2024, we will develop further our in vivo printer and start selling those printers also, so the more advanced version also to researchers clinical research. And so that would be the revenue streams up to the time we will be ready after we receive, as you can appreciate, the regulatory approvals and the EMEA approval, and to be able to sell our protocol and the application in the market. So at that time, we will have a revenue stream from the sales of the hardware, from renting the in vivo printers to customers, and from the recurring fee per operation of using our application in the OR, okay, for the in vivo printing of the neobladder.
So great to know, and I would like to share that on that cancer, more than 550,000 cases per year.
Yes.
Yeah, the numbers are huge, as you said.
The numbers are huge. Yes.
Yeah.
Not all of those are eligible for cystectomy. About 200,000 are eligible for cystectomy, and that would be our SAM, our serviceable addressable market. And then we plan to focus on Western Europe and North America at the beginning. Okay, so there are about 8,000 cases that we are after initially.
Okay, share with us some more about the market and how you expect to be in the next 5 years. You share with us that you are going to be full on the market. I mean, you're gonna sell what you have, that you are going to build. Share with us some more about the market and your plans.
As I said, the traction initially in 2027 would start from the hardware, which is the simple version of the printer, and then the in vivo version of the printer. And then as of 2027, we will start selling or renting the printers to hospitals and clinics, that they will be using the printer in order to perform the in vivo neobladder to their patients. Okay, so we plan to start with Western Europe. So the big countries in Western Europe, of course, Greece is where based here. So Italy, Germany, Switzerland, France, and the UK initially. So we will set up either our own direct sales force or distributor network in order to be able to cover the markets that we are aiming at the beginning. Okay, we have plans to have an assembly line or an assembly type of manufacturing here in Greece, because as you can appreciate, the printer is not built; it's assembled. You assemble the parts of the printer, of course, based on the technology and the know-how. And so we will have a plan here, and we will also have a training center in order to train the clinicians, of course, and the users of the printer in order to be able to perform the in vivo bioprinting and the neobladder operation.
Are there any projections for this type of cancer for the next few years? I mean that, is it something that it seems it's growing, or it's something that it's getting bigger or not?
Well, you can anticipate that given the improvement in health habits, that it's not going to be a booming market. But trust me, there are enough people to cover that the demand in the foreseeable future. At the same time, in addition to bladder cancer, we are focusing on applications of cartilage and esophagus, and we may even consider some other areas next. But for now, we are focusing on bladder cancer. We have the expertise. It's what we are proposing seems to be working. This is what the preliminary clinical data are telling us. And then once we get the approvals, we will launch and commercialize this solution to the market. But it's a very, very important first proof of concept. We are confident that it was the best choice for the application of the technology.
So you're the best choice, but are there any other choices? And what about the competition?
No, I meant the best choice was the bladder cancer, not just, yes. Now, listen, we are the first who are actually introducing in vivo bioprinting. Okay, there are competitors, some pretty big companies that are working on bioprinting and laser bioprinting, which is the technology we follow. There are competitors in laser bioprinting and competitors in inkjet bioprinting and extrusion bioprinting, but nobody is currently introducing or doing any clinical research on in vivo bioprinting. So this is what makes us as PhosPrint unique. That this is the application to be applied in the OR, operating room.
How easy is for the others to enter that field? I mean, are there any barriers? Is it something protected with patents, as you said?
We are, yeah, the protocols, we have protection on the protocol for the neo-bladder. I mean, we anticipate that at some point more competitors will enter the field also for in vivo, but currently we're on our own. Yeah.
Mm-hmm. So there are there any other players that probably move to that field, or you see something that is going on, or are there any other startups that are willing to enter the bladder cancer?
I don't know about startups. As I said, there are competitors in bioprinting currently. Whether they will move into bladder, I don't know if they have the expertise. Well, first of all, we are protected, okay? But will others be entering the field? Yes, absolutely. I mean, we are at the beginning of what bioprinting will do to healthcare, I believe. Okay? Mm-hmm. It is considered one of the big innovations of the future, and that will disrupt the healthcare system. So we're at the beginning. So yes, we can anticipate that others will join. Not in new bladder, since we are protecting it. We have intellectual property on this sort of operation.
Okay, and as you are the specialist and the CFO of the PhosPrint, could you share more about the financials that can make it happen, how you can make it sustainable until being on the market and selling to customers?
Okay, well, in order to prove our concept and complete all of those required steps for development, as I said, we were fortunate to receive a grant from the EIC. We are currently looking for more funding for 800,000. That will take us until the end of or the completion of phase 1 human trials, the first human trials. And we do anticipate the market value of the company to multiply at that stage because the concept would have been proven. And then from then on, we will need approximately another 5 million to continue until the commercialization point. And the first year we commercialize, we plan to break even. So, we're taking a very, very careful and well projected staged approach in our development and in our funding needs. So with the 2.8 million, we will get to that level of phase 1 human trials, and then we will need another 5 million for the scale up and the creation of the assembly facility, the training center, and also to finalize all of the human trials and the regulatory process.
Until now, you are bootstrapped and you combine it with the funding from the European the grants that you get. And how do you feel right now? And how urgent is to raise that money, that 800,000?
We would like to have received half of it by the end of this year, and then half of it next year. Okay. Because currently, yes, we are financed. We received some prize money. For instance, a few years back, we won the proof of concept competition of Patra's Technology Park. So we had 50,000 grant there. We also received funding from the Bodosaki Foundation for our intellectual property, and we also participate in some European projects that have contributed to the funding of PhosPrint up to this point with all the activities that are happening. But for the completion of this project, yes, we rely on the EIC, which is great to have grant money for a project like this, institutional funding, and also hopefully we'll get the investors that will contribute the 800,000 that is missing until we reach that very, very crucial milestone of completing phase 1 clinical trials on humans. After, of course, we run the preclinicals on animals.
Let me note something that it is expected that by 2025, the bioprinting market will grow over 4.7 billion. So
Yes.
market is huge, and
It's huge.
something
It's huge.
that's gonna be it's on the very early stages.
Yes. Yes.
You are on I think on a very promising and really
Exciting
space.
word. Yes.
And
Yes.
I would like to learn more about the team that you would like to
share.
make happen.
Okay.
You share with us some names.
Of course.
Before. Please tell us more.
Yes. So Dr. Ioanna Zeriotis, co-founder, acting CEO, CTO. She's also co-inventor on our IP. She's the first scientist worldwide who published laser-induced forward transfer for solid phase DNA printing. So she has a lot of history, and she's very, very highly recognized in the laser world. Okay, that's how we participated actually in the Photonics West, which is a competition of photonics companies, and we ended up receiving the third prize yesterday in the Startup Challenge. Dr. Apostolos Klinakis, also co-founder, he's the clinical director. He has 25 years background in cancer biology, mouse genetics, stem cell biology, so he's the strong link with the choice of bladder cancer application first. There is myself that I talked about myself earlier, and we have the new generation supporting us, Dr. Ioanna Theocharis, biochemist, Evina Elezoglu, she has a master's of science, she's a physicist, so she's working on the bioprinting process development. We have Dr. Panos Karakaidos, who's a biologist, he works on cells expansions, and we are also blessed with a very, very strong advisory council. We have Dr. Lambros Kourtis, who's a serial entrepreneur, inventor, angel investor. He is also venture capitalist. He was a member in a venture capital firm. He's created his own startups successfully in the US. We also have Dr. Dirk Groenewegen, who was our EIC coach and is now working with us as an advisor. He's a CEO of Cell for Therapy. He's a business expert. He's from the Netherlands, by the way. He's also an angel investor in startups in regenerative medicine. And we had another addition of another expert in the advisory council, but we can talk about that next time.
Okay. So you give us a promise to talk for another more time, and that's great. So until then, I would like to ask about your vision and your mission. I mean, the big picture of what PhosPrint wanna change in our world.
Well, actually, we want to transform the healthcare environment by introducing in vivo bioprinting. Okay, because we believe that bioprinting is truly the big change factor in healthcare for the future. It will be the big innovations will come from bioprinting. And when you think about it, the big expectation for bioprinting is to eliminate the transplantation risks, eliminate all of those issues for people losing their lives because they cannot get an organ on time. Okay, so hopefully we will contribute to a small or very large degree to making that happen. Okay, we'll be one of the contributors.
That's very great, and the vision and people behind the project, it's something quite important, especially when you are on the very, very early steps as you are, and it seems to be very unique what you are doing, and a very promising
Thank you.
Let's say industry. So I would like to wish you the best, and also I
Thank
would
you, Thanos.
like you to share with us your favorite quote, or to tell us where do you find inspiration in order to keep to keep it up and continue doing what we are doing.
My favorite quote is "Where there is a will, there is a way." To be very honest, it's been my favorite quote since I can remember myself. I find inspiration in making a difference. I don't know how to explain it. It's something that comes from within. I guess I'm a very positive person. I always see the glass half full, not half empty. So it's a character thing. I think that's the thing, and I refuse to become cynical. Despite my age, and I'm middle aged, I refuse to become cynical because it takes away the enthusiasm.
Exactly, and it's quite positive to have. It's a way of life actually, and
Yes, I agree with you 100%. Yes.
it's something that we have to the new generation will have to learn from that, and to be positive and to face our life with that way. So Maria, it's my pleasure to have you and to talk about PhosPrint. I wish
Thank you,
you the best,
Thanos.
and we will be for sure in touch. So thanks a lot.
Thank you so much. Thank you. Bye bye.